As of this week, Americans are able to order a set of 4 rapid at-home COVID tests from the federal government. They're being distributed by the United States Postal Service, and getting one is supposed to be easy. Now, while this is a step in the right direction towards keeping Americans healthy and safe, it is a system with gaps that people can easily fall through, potentially leaving swaths of American communities without access to these federally purchased tests. Dr. Rihanna Elise Anderson noticed this herself when she went to go register for tests. She took to Twitter saying, "While I'm grateful for the tests, I was unaware that it was 4 per household. As a family researcher, this racially disproportionate policy will lead household-dense families, often of color, to make tough and risky decisions that others won't, especially as essential workers." Dr. Anderson was kind enough to join us.
I'm an assistant professor at the University of Michigan School of Public Health in the Health Behavior and Health Education Department.
You put the word household in all caps, like you couldn't believe that was how they were breaking it up. And I wanted to give you a chance to expand on that a little bit more.
I am one person living in my household, and I felt incredible privilege, incredible desperation between me and other people who I know have 4 or 5 or even more people within the household. So the question of if someone even tests positive once, needing to take a second one just for themselves, that's 2 people. That's 2 people that we're talking about benefiting from that policy. So it was a bit challenging for me to find that. And I know how challenging it must be to have a policy that's all encompassing of all of the different challenges that are going to be coming from this rollout. Who's being impacted, especially here in Detroit or in other urban areas? Who's being impacted and why? Those areas of greater density where you have people who are in households or in multi-unit buildings that are passing each other, needing to be around each other in these communal settings, that is one of the reasons why you saw those racial disparities. So again, whether it's by house or just the area that folks are in, you've got to focus on how one single approach might ripple in varying ways with different communities.
This, of course, would lead me to my next question that I don't know if anybody has a perfect answer for, but in the second rollout, what would you suggest, or like in a perfect world, how would it be adjusted or changed in any way to have a more broad covering of people who are able to receive tests?
Yeah, so here's what we do know, Jamaica. We know that if you are to use certain standards, like how many people were listed in the census, how many people the Postal Service have on record for living there, what the tax returns show, any one singular way that you try to roll this out is going to have problems. We're going to face a problem where folks perhaps are not documented and living in a space with other people. You're going to have a cousin who needed to stay at one point with a family member and they're transient, so they don't have residency there or occupancy. We get that. And I'm not saying that there is a perfect way. But in this critique, what I think we can do is layer what we do know about some of these things. We know if we take records from public schools, from the census, from these public spaces where we're taking an approach where publicly available data can be compiled so that we get a better estimate. It's not about a perfect estimate at this point. It's a better estimate of how many people are in this house. And again, to acknowledge the hard work that they're doing to say some people may not have the internet, so here's a phone line. Some people may not be able to have things delivered, and so please call this number if you're having challenges. There are things that are baked in to say this isn't perfect. One of the biggest pushbacks from the critique, so people who are saying, at least we got this kit, right? And I want to steep this in gratitude. One of the biggest pushbacks is, if we kept waiting to compile this data, we wouldn't have got these kits out. So I agree with that. I think one of the places where there was a misstep was in communication. So the White House COVID committee absolutely is planning to do additional rollouts at some point. But what was voiced to the public was, here's this kit. We're excited to get this out to you. So if there were communications and infographics, something that explains step 1, let's just get it out while there is this surge. Step 2, we're going to work toward better systems of getting as many to your house as we need. If that was voiced to us, I think that would have been something that dissuaded some of the pushback that you were seeing yesterday on Twitter.
Absolutely. I agree. They should send something out. So just let us know, how is this going to work? First and foremost, because there are people who are living above, businesses, or they're living in huge apartment complexes. And I'm seeing all over my feed all day, I can't get tests, I can't get tests. And these are people with computers and internet access. And that doesn't even begin to, address our unhoused population. How do we get tests to them? And people, like you said, so I agree. I think it is an extremely fair critique. Like I said, I hadn't seen it or heard it really been discussed or kind of fleshed out before. So I really appreciate you taking the time to kind of talk through it.
As a scientist, as a researcher, as someone who thinks very critically about opinion and facts and public opinion and the ways that we have to fight all of these at each step, again, it's a space where if folks have a critique that is steeped in something that has veracity, has truth, then that's something we need to uplift. How can we help our government to understand these are opinions based in fact? These are desires. You're hearing of people saying, I want to be well, I want to be healthy, I want to be safe. That's what we're hearing. And so taking those opinions that are steeped in fact and amplifying that is what we're doing.